because Meningitis World Awareness Day comes up on October 5th. Good morning, Dr. Akase and Mrs. Braithwaite. It is a pleasure to have you both here with us on the program.
Morning. Happy to be here.
Thank you.
So we're going to be talking about meningitis. So Dr. Akase, can you tell us briefly what it is? The reason why, first actually, let's just discuss why we have to talk about meningitis. Why is it important? Is it something that's common in our country? If so, why is it a lot of people don't know about it? Dr. Akase.
Thank you very much, Dr. Pamela. So meningitis, simply put, refers to an infection that affects the membranes that cover the brain and the spinal cord. And it's quite common in Nigeria because of part of what is called the meningitis belt that runs all across West Africa. You know, Nigeria being inclusive, includes up to 26 countries, in that belt. Seasonally, we have outbreaks that affect thousands and thousands of people, causing hundreds of deaths, mainly among children and those who have never been vaccinated. Those who survive may be left with complications, difficulty with hearing, difficulty with seeing, and all of that. So it's a big problem, and it's easily preventable.
But the reason, the issue that we have is a lot of people don't know what meningitis is, in spite of the fact you've said it's affects thousands of people. I mean, what you've described, you should be able to go up to any man on the street and say, you know about meningitis, but most people don't know what it is. Why?
I mean, it's a problem it is we have with most endemic illnesses in our community, where it seems people who are not directly affected don't seem to care until they have somebody who has a problem and then they go to the hospital. It's a failure around awareness and also about communication, risk communication. The organizations that should do this, but because we have so much going on, I guess, people just simply don't pay enough attention to some of these things. But truly, like you said, there's enough awareness about meningitis at all. Yeah.
And if I can just go into it a bit more, because the issue is we keep talking about, epidemics. So, for example, there was a big noise about, monkeypox. And, we could consider a number of people who have monkeypox. You consider a number of deaths of monkeypox, and yet you look at something like meningitis, or you look at something like tuberculosis. You would have thought there should be somebody shouting from the rooftops, letting people know about the infectivity, about the risks, about what they can do to protect themselves. Why isn't this happening?
Well, I mean, without going into too much detail, there's so many things that are going to this. But most importantly, it's about investment and about vested interest. We don't know that most times, most of this, we have not taken ownership in responding to most of these outbreaks. So the agenda is not being set by us. It's about who is funding and what he wants to put the money or the attention into. So at the end of the day, we're recipients of whatever is available to be given. And until we take ownership of what our problems are, where we feel we're being hit the most, until that happens, we'll still be at the mercy of this kind of, because we know that mpox, as it was, it's been made now because Europeans and other countries have started seeing cases. And that's why we're now seeing noise about it. But now that, meningitis is essentially, a West African thing, and even within the country, it's mainly a problem in the northern part of the country. In the south, most people don't even know about it because we don't see the cases. Occasionally, we see sporadic cases. So it boils down to the fact that those who are most affected, may not have a voice to talk about it, really. Yeah.
Well, here we are. Thank goodness we have a voice and we are raising it to speak about meningitis. So can you explain further, what are the symptoms of meningitis? So if a person says, a person listening now and wants to know about meningitis, to perhaps go and share this information back home when they get home in the evening or whatever, what is meningitis and how does it present? And very important, how does it spread from person to person?
Okay, thank you very much, Dr. Pamela. So, like we said at the beginning, meningitis simply means there's infection affecting the membranes that cover the brain and the spinal cord. Now, when people get infected, and this infection can be from bacteria, can be from fungi, can be even from tuberculosis or even viruses, right? Now, when this happens, the commonest symptom, because an infection, they may have a fever, and then they may have headaches, and neck pain. These are the classical, symptoms at the earliest, stage, of illnesses. So most times within a day, if somebody's having a fever and a headache, especially during the dry times of the year from October all the way down to March, April, go to hospital, go and, and get checked out, because it could be that the person is dealing with meningitis, especially if they're children and those who have never, been vaccinated, with meningitis at all. By the time people don't come to hospital early enough, other problems can start coming up. They can start having convulsions or difficulty with hearing or difficulty with seeing. These are all complications that can happen if, the individual has not, dealt with, come to hospital, early enough. Yeah.
Well, the good thing is that Nigeria has some exciting news. We're launching something special, something to do with prevention. Can you tell us a bit about it?
Yeah, fantastic. The Honorable Minister of Health is someone that has, background in vaccines and all that. So because we are at the belt and outbreaks for meningitis have gone on for so long, Nigeria has launched the pentavalent, the 5-in-1, they call it MEN5, 5-in-1 vaccine that is able to cover for all the serotypes, even though we have, so the commonest organism is Neisseria meningitidis, and it has 5 serotypes that cause that. Serotype A, which has been always the commonest, has gone low because the specific vaccine for that was deployed from 2011 or thereabout, and so that particular serotype has gone down. But what has happened is that other serotypes have now come up. So it's important to provide coverage for all of them instead of just selecting 1 or 2. Before now, we've had A. After A went down, we had C. After, C came up now. So it's important to cover all 5 so you don't give room. And Nigeria is the first country that has rolled this out because, again, we're the most populous country in West Africa. We have the largest number of cases. And northern Nigeria has the perfect conditions for meningitis. The weather is dry, humidity is low, temperature is high. And this, the pathway of transmission usually through, respiration. So when the weather is dry, the nostrils get dried up, and damage can occur. People can get infected. There's overcrowding. All of these are perfect conditions, to do that. So Nigeria is a perfect condition, country to roll this out. And if it works very well in a country, then clearly it's a big plus globally for everyone here.
Okay, no, that's great. That's great. So this is a revolution, and who needs to take it? So for those listening now, is it only the people in the north that need to take the vaccines, or do those of us in the south need to take it too?
So one of the things they're trying to do is to make it routine for everyone in the age group, those who is preventable. But usually for people who have missed it, when there's an outbreak somewhere.
Sorry, what age? What age? You just said in the age. What age?
So people who are less than 15 years old and who live in those conditions, they should, if they have not gotten it, they should, go and get one. But in the routine vaccinations for people who are, less than 1 year, it should be part of their routine vaccinations.
And if they take it once, is it for life, or do you have to have booster doses?
Yeah, because it's a conjugate vaccine. So without getting too much details, conjugate vaccines have long-lasting immunity. People who take conjugate vaccines once can have immunity for decades, as the case may be. And that's the good thing about this particular vaccine. The earlier ones were polysaccharides, which have poor lasting immunity. This is conjugate. So it introduces a whole new element to this, that immunity can last longer for anybody who has taken. So a single dose provides long-lasting immunity for everyone. And we know that when everyone in the community has taken it, we provide herd immunity that protects, one person protects another, and the whole community gets protected, at the end of the day.
It's actually very fortunate because COVID has taught us all a lot about vaccination. So most people understand what you're talking about now. In the past, maybe they wouldn't have, but now they understand. And also, I think they also understand the issue of different types, of things causing, issues. But very fortunate, I think, that we have this vaccine. So, but if a person, for example, gets sick, obviously people who haven't had the vaccine, and are you saying it's available now for all our babies across the country?
Okay, so for logistic reasons, I'm sure the deployment is still going on. I'm not sure it has gotten to all levels for everybody who needs it. It's still the piloting phase. where the country is rolling it out to see in terms of logistics, in terms of acceptability, in terms of cultural acceptance and all of that, which are very important, especially in the northern parts of the country. You know, the highest burden states in the country were Jigawa State, Bauchi, and I think Yobe were the ones that started it first because they border Nigeria Republic, which is where most of this cross-border travel and all that, and which are some of the drier states in the country and the most, impoverished states as well. So, the rollout started there. I'm sure eventually it reached everywhere in the country, but I'm sure it has not gotten to everywhere yet. That's
okay, but it's on its way. And the thing is to make sure we embrace it when it comes to prevent terrible illness and terrible sequelae. So, but there is treatment for meningitis when a person gets meningitis, yeah?
Yeah, there's treatment. And in fact, treatment, so without going into too much detail, the meningitis can happen as an outbreak where many people are affected. For the kind of organisms that cause that kind of meningitis, even one shot treatment is very effective, especially, where people don't have bed spaces and money to come for admission. So it's an easily treatable condition once people come to hospital in a timely manner. So antibiotics within a few days, that are given within a few days can take care of people that come to hospital. And also, but presenting in a timely manner is very, very important to prevent, not to treat not only the meningitis, but to take care of complications that may come after.
And that's why it's so important that when you have some simple symptoms, headaches, etc., and some of these symptoms that people just go to the pharmacy and take Panadol for, it's so important that if there are other things associated with it, that they go to the hospital on time. Thank you very much. Thank you, Mrs. Braithwaite, for coming on the program. It's always a pleasure to have you with us. And today is a very special time, isn't it? A special anniversary. Can you tell us about why this is a special year and what you need us to know about it?
Yes, thank you very much, Dr. Pamela. Today is special because, this month or this year is special because it marks the 10th anniversary of our daughter's passing, who sadly passed through having contracted meningitis. She was actually found in her sleep, so we don't really have much knowledge on how she contacted it, but she was found and the autopsy told us it was meningitis.
And she was found in university, wasn't she?
Yes, she was
found in her room in university.
Yes, she just started 3 months prior at Swansea, and that was when they found her in her room on the last day of term. And it was that was how we got to know that she had passed, and then the autopsy now gave us confirmation of what happened. So that was how we know she died of meningitis.
But you've had other people who, yes.
However, because we didn't know much about meningitis of what she had, we had a son that had one that had experienced it the year before, and basically he suffered from stiff neck, light sensitivity to light, headache. He was throwing up, and he was quickly rushed to A&E by his friends at the uni. And the doctor that saw him was quick in diagnosing what he had, and he gave him the 7 very long injections that antibiotics through his spine so that he could be treated, and that was how he was saved, thankfully for us. So that's how bad and quick meningitis can be. He was lucky; he was diagnosed early. She wasn't, and she went from it.
Honestly, it's such a painful thing, and I thank you for sharing that, because I know that's the reason why you set up the foundation that you have. But what is very interesting is that these things do happen. Particularly that diagnosis was made because it was done in the UK. But I know of cases of students in university being found dead, and then people blame it on drugs, they blame it on this, they blame it on that, without doing a proper autopsy and finding the cause. So tell us about what your foundation, the Boom for Good, has been doing since you set it up, since your daughter died.
Because because of our loss, we felt as a family that we didn't want other families to go through this. So we were particularly challenged, or we wanted to bring awareness to other families so that they will not go through this painful loss that we went through. So we've been trying to raise awareness, because I think the first thing is awareness. People don't even know what meningitis is. It's actually described as a silent killer in England, because like my daughter, she was just in bed and then the next thing she's gone. But before that, she had a slight cold. So something as simple as a small cold, you don't know what it's going to translate into. So it's important for people to be aware of all symptoms. There are about 10 or so quick symptoms that will tell you what you should be looking for when you're dealing with meningitis. And like I described earlier, light, sensitivity to light, stiff neck, headache, vomiting. These are the quick things that a child might be going through. Not necessarily even a child. She was a teenager that can be going through, and will probably say, oh, maybe it's malaria, but it's not. So what we're trying to say to people is that be aware, have at the back of your mind, it could be something else, especially if you've already treated malaria for 1 or 2, 3 days and it's not going. Be quick, be observant, look closely at your child. Adults can talk, but babies can't, because another lady reached out to me who had a baby. She just had the child like 2 days, and the child had meningitis. And luckily, through our intervention, we brought in doctors and people to advise her. She was able to save that child, and that child is living today. So it's about quick intervention with meningitis, and that is what we want to bring the awareness of. We want you to know that this thing can happen suddenly. So many stories we've heard, and these are the things that are saying that they wish they had listened to their instincts, especially mothers. Your mothers are never wrong in their instincts.
Very important. Instinct says go to hospital. It doesn't matter whether you think it's mild or not. Just go. Just go and have the things checked out. I think that's the message you're giving us now. So with the boom for good meningitis, do you have any special plans for this year?
Well, yearly we do different programs. This year because it's her 10th year, we just want to talk on awareness. But going forward into to next year, which would actually be the foundation's 10th year, we will do something. If we're going to do more programs. But to wrap up this year, we want to do like awareness through schools. We've done a few of this where we go to schools and we talk about meningitis to the students. We do it through play. Like, can you spell meningitis? We try and do it in an interactive way so that the children take something away. And then we tend to target students that are going away, to university, because that is the age that normally it's recommended that you take the second one, because you take one when your next one is when you're in your 60s. So, but I heard the doctor saying that they've now rolled out a new CY vaccine, which is the 5-in-1 in Nigeria, which is really good. Unfortunately, Temi had only the C, which they gave. But if she had had the 5-in-1, it would have prevented her. So I'm happy that this is being done in Nigeria now.
Thank you. Dr. Akase, having heard what is, unfortunately, time is fast spent, but do you have any sort of last words for our listeners or anything to add to what Mrs. Braithwaite has said?
Yeah, I mean, this story sort of, as painful and tragic, it sort of paints some of the things we see outside the typical meningitis shield. People in that age group who are going to new environments, hostels, dormitories, get exposed to other people for the first time. Some of those people were not vaccinated and so are carriers of these strains of meningitis, can transmit it. And unfortunately, we hear this story over and over again. People going to new environments, new schools, camps, barracks, and all of that. So it's very, very important for people who are going to these new environments to check up on if you have not been vaccinated, when you get your vaccines in place, because you just never know who is a carrier. They have no symptoms at all, but they can transmit the infection to others. And, the story can, with that. So it's quite important
very
for this
tragic.
awareness. Yes, quite tragic. Yeah.
Okay. So do you have any last words for our listeners?
Yeah, so I think I'm so happy that we have NGOs like this who are creating awareness. Like she said, it's a silent killer out there. Parents need to be aware to make sure that they give their children the best form of protection. Vaccination is easily preventable with the right vaccination. And thankfully, we have tools now, 5-in-1 especially, like we said, that can hopefully the more it comes out. But before that comes, go and get the ones that are available, them in A, them in C, those are available. And I'm sure, until the 5-in-1 comes up, we'll make do with these ones and make sure. Now, apart from this, we have the Haemophilus influenza vaccine. It also protects against meningitis as well. So ask around, and I'm sure your doctors will tell you which best vaccine your child needs. Yeah.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.